I mean, those young champions representing nutrition internationally, I mean, very, very vocal. And what a discussion around what it means to be a real man in your community. I mean, I personally hear discussions like that all the time within my social groups and other social groups, so it's definitely one to sort of mull over.
Definitely the graft. And more great sessions to choose from this afternoon. Most of our governments have committed to healthcare for everyone, universal healthcare. But what is the reality for young people trying to access healthcare in these times of workforce shortages? We have a session coming up called From Silos to Systems, Bridging Adolescents into the Healthcare Agenda. Another great session to look forward to, with an incredible title, is about empowering young people in matters of sexuality education. It's called Ask Us What We Need, Youth-Led Approaches to Redefining Sexuality Education.
Now, we have had a lot of fantastic music in this show so far. That Leonis to Genius number is, you know, it's firmly in my head, just running round and round and round. And it's such a great way to do advocacy, which is why we're proud to present the winners of the Art for Wellbeing Music Awards. Check this out.
My piece addresses that. It addresses a mental health issue, and it also gives semi-solutions to how people can help reduce the issues that come with mental health. And I feel like it's really relevant to the young people to listen to. And I would also encourage them to listen to other contestant species, because they were also addressing well-being issues that were not mental. And I feel like if some of the people close to me or some of the people in my circle could listen to that, those well-being issues being addressed by other contestants could help improve them.
Oh God, our demons, thoughts we can't escape. It mentally eats us and lead to distress, depression, anxiety, become our friends, preying on traumas that we can't erase. Let us talk to each other, let's encourage mental health. Let us join our forces and put end to suicides. I'm really getting tired not being in control of me, of my thoughts, of my health, of everything I love. I just need my mental health. Ndinepfungwa dzandinoda kuti dzitame, dzikadzoka inini handirare, dzikadzoka inini handifare, dzikadzoka inini handirare. Ndinepfungwa dzandinoda kuti dzitame, dzikadzoka inini handirare, dzikadzoka inini handifare.
Clues to what I crave.
My entry truly speaks my heart, as I want to convey that our well-being does not solely lie in material, but it is embracing things in life that may look simple to us. So I think my message would have resonated with young adolescents who are in the phase of truly understanding life and figuring out their springs of well-being. While music has been something I deeply cherish, I'm glad that I've incorporated music to deliver something really strong. Finally, a massive thank you goes out to all the organizers, to my beloved school, my supporters, and to those who loved my piece of art.
In a world of complexities, back then I would have thought the clues to what I crave lie in materials, but then turns out that it was compiled with blocks of life that meant to me much more than anything to say. Ooh, I'm proud of myself, my resilience. Ooh, your hands get me out of the deepest trench with all that I've learned. So what's kept me safe for all the nourishment that has made me grow? Well, that's what I've been needing all this time, all this time.
my song, I aspire to inspire anyone who listens to it, irrespective of their location, to find strength within themselves, believe in their abilities, and remain motivated to persevere. Also, I would like to mention that one of my teenager friends told me that when she was listening to my song, she was sad, but the song uplifted her and made her feel herself more powerful. I sincerely hope that my music resonates with people from every corner of the world, reminding them to prioritize their well-being and offering encouragement during challenging times.
Find the way you are. No one can instruct you. Find a show that's yours. Go ahead and break all walls. Don't listen to your guilty advisors. No more. Your brain is much more nice, ready to realize what's yours. Feel the sound of care. Change your theme in poesy. Keep your secrets safe. Never blame yourself in any case. Don't listen to your fears and uncertainties. No more. Your heart is much more nice, ready to realize what's break the rules for you now. They're created for decades. You can even break the ones you always try to say. You can change the color of yours. Many different colors. You can save the better ones for many sticky spots. Don't listen to your fears and uncertainties. No more. Your heart is much more nice, ready to realize what's yours. No more. You are so much more nice, ready to realize what's yours.
Good morning, good afternoon, and good evening. My name is John Klein. I'm the president of the International Association for Adolescent Health and the treasurer and a member of the executive committee for the International Pediatric Association. And it is my pleasure to welcome you to this session on Track A, Good Health, from Silos to Systems, Strengthening Adolescent Health as part of the Universal Healthcare Agenda. Today's session, as several of the previous sessions have mentioned, is about what can we do to have better health services for adolescents and young adults. We will explore the challenges that adolescents face in getting access to comprehensive, respectful care, and why this is an important gap in the UHC movement, and the challenges that healthcare providers face in providing care to adolescents, including how workforce shortages impact the delivery of services. We'll also feature some examples where youth advocacy and accountability and commitments from healthcare professional associations have been able to help ensure that adolescent needs and rights are integrated into the health system. I'd like to introduce my co-moderator, Yahan Zhu, from the International Federation of Medical Students, who will tell us a little more about how the session will run. Over to you, Yahan.
Thank you, John. Hi, everyone. Welcome to the session. My name is Yahan, pronounced Shekhar. I'm currently a third-year medical student based in Sydney, Australia. I am the liaison officer for sexual and reproductive health and rights issues at the International Federation of Medical Student Associations. So during this session, we try to bring everyone closer together through this session, even though everyone is joining from different locations. Which shouldn't be very hard because we share the same goal of integrating adolescent health into the health agenda. We try to make this session as interactive as possible, so please do not hesitate to send through your questions and comments in the chat. We have our chat moderator who will be monitoring the chat during the session, and it's a fantastic opportunity to engage with our other participants. On top of that, we also set up a couple polls, which will be an opportunity for you to share with us what your opinions on the topics relevant to our discussions today are. So the first poll question coming up is, what do you think is the biggest health issue when it comes to adolescents? So some of the options we have here are sexual and reproductive health and rights, non-communicable diseases, mental health, violence and injuries. And if there are any other answers you guys would like to suggest, please feel free to type that in the chat. The poll will close after our first segment, and we will then look at the results together shortly afterwards. So now, without further ado, I'll pass it back to John to introduce our first speaker of the session.
Great, thank you, Yahan. And you should be seeing the poll for the first interactive question now. So please go ahead and put in your answers because we'll be sharing them with the group soon. They should be visible to you as they're recorded. So in the first section today, we are going to talk from the young people's perspective on setting the stage for what we need for health services and sharing some of the data that's come in from the What Young People Want survey. Let me start by introducing Katja Sick, who is a leader with the International Youth Health Organization, to help us set the stage. Katja, over to you.
Passing the floor. So as it was already mentioned, a vital but very often overlooked aspect is the power of youth voices and youth perspectives, especially when it comes to universal health coverage, because it might be a topic that is not very close to young people's hearts, or at least they don't know how much it affects them. And adolescent health is a multifaceted issue that requires multidimensional solutions, yet all too often young people are left on the sidelines of decision-making processes, even though we're not just 1.8, but 1.9 billion strong. The voices are being stifled, the perspectives are disregarded, and sometimes even the basic human rights are erased, especially in the sense of universal health coverage. So it is high time that we change this narrative and recognize that young people have a fundamental right to participate in shaping policies and programs that directly affect their lives, especially ones concerning their health and well-being. So it is crucial that we look at UHC, but also from the human rights perspective, not just concerning healthcare, but also some of the basics like clean and healthy environments, access to education, clean water, and much more. And all of these are actually directly impacting the 6 building blocks of UHC. Youth voices do bring unique insights and lived experiences to the table. So not only do young people have firsthand knowledge of the barriers and gaps concerning universal health coverage, but they also possess innovative ideas and creative solutions to overcome these obstacles. So these perspectives can help us identify and tackle the root causes of health disparities, leading to more equitable and accessible healthcare for all adolescents. Furthermore, engaging youth fosters a sense of ownership and accountability, so they can become advocates for their own health and the health of their peers. This does not only benefit individuals, but also contributes to building strong and resilient healthcare systems, as well as communities that value health. So to achieve genuine youth involvement, we must create safe spaces where young people can voice their concerns without fear of judgment or dismissal. We need to invest in youth-led organizations and initiatives that provide platforms for meaningful participation. So governments, civil society, and other stakeholders should actively seek out youth perspectives, listen, and integrate these perspectives into decision-making processes to adequately address the needs. So in conclusion, we cannot achieve comprehensive universal health coverage without amplifying youth voices. We're not just passive recipients of healthcare, but active agents of change. So we need to commit that in order to create a healthier, more equitable, and prosperous future for all. Thank you.
Thank you so much, Katja. Our next speaker is Aditi Sivakumar. She's a medical student, an advocate, highly accomplished in many different areas, but she also is the co-chair for youth, but the co-chair for the entire Partnership for Maternal Child Health, Partnership for Women's, Children, and Adolescents Health. And it's a pleasure to welcome her to share some of what we've learned from what young people want. Aditi, over to you.
Thank you so much, John. It's a pleasure to be here with everyone today. My name is Aditi Sivakumar. I am the board vice chair under 30 for PMNCH, and I'm so excited to be here with you all to talk about the Global Forum for Adolescents, the 1.8 billion Young People for Change campaign, and how we at PMNCH are working to address the unmet needs of adolescents. So the What Young People Want initiative was launched by PMNCH in early 2023. And it is the world's largest survey of youth opinion used to drive in national policy, investment, and action. And the What Young People Want initiative takes into account meaningful adolescent and youth engagement by providing a robust platform for youth to share their opinions with the highest level of decision-making processes. Through this initiative, we essentially asked adolescents from the ages of 10 to 24 one simple question: to improve my well-being, I want, and we allowed them to fill in the blanks. And I'm so proud to say that today we have over 1 million adolescents who have participated in this initiative from continent to continent across the globe, and we are still actively trying to amplify youth voices. The responses were then categorized into 1 of 5 domains for adolescent well-being, and the domain good health and optimum nutrition had the second highest number of responses at 13.6%. So an overview of the most frequent words for each domain is also available on word clouds, which can be seen on the 1.8 billion Young People for Change campaign website. And for good health and optimum nutrition, the main words included health, education, nutrition, access, and sexual health. And we also have direct quotes from adolescents across the globe who've participated in this campaign. For example, we have a 20-year-old man from Indonesia who said there's a need to increase the quality of healthcare. And we have a 15-year-old woman from Liberia who said sexual and reproductive health education and service is important to her. In 2021 alone, 4,500 adolescents and youth passed away every single day due to health-related concerns. For example, 1 in 6 children or adolescents experience early pregnancy and childbirth. There are over 115,000 road traffic injuries resulting in death every single year. We have over 1.8 billion adolescents worldwide, and in some countries, adolescents make up a quarter of the population. However, globally, there are more than 1.5 million adolescent deaths every single year. And while a majority of these deaths are preventable or treatable, adolescents face numerous barriers in terms of accessing healthcare. Progress towards universal health coverage requires keeping young people healthy, and adolescence represents a critical window of opportunity for effective prevention and treatment that can last the life course. Delivering universal health coverage requires addressing priority areas, including improving service delivery, laws and policies, increasing financing, and strengthening governance. And I'm looking forward to working with you all to ensure universal health coverage for adolescents. Thank you.
Thank you, Aditi, for your insights into the needs of youth and the actions needed to address this important issue. We also have here the results of the poll that we've done earlier. The results is what's rapidly changing. So at the moment, we have the highest is mental health, it's 43%, and sexual reproductive health and rights was 42%, which was also mentioned by Aditi. So the greatest number of audience commenting on mental health issues and the urgency to address also highlight the need of the actions we need to implement. We can also see that the results match very well. And so now, please allow me to introduce our next pair of speakers, Patrick and Melis. So Patrick, too, is a Council of International Neonatal Nursing board member, currently working as a neonatal nurse in Newborn Unit Kenyatta Hospital in Kenya. He represents COIN in PMNCH under the youth constituency. He is a registered nurse with a higher national diploma in neonatal nursing. He is currently at Aga Khan University for Bachelor of Science in Nursing. And another speaker would be Melis. Melis is an associate professor of pediatrics and an adolescent medicine specialist at the HSTP University. She's a co-chair of the IAH Emerging Professional Network and a member of IAH Education Committee. She's the assistant program coordinator of the third-year medical students and serves as a member of Pediatrics Residency Education Board at HSTP University Faculty of Medicine. So Patrick and Melis, all over to you.
Thank you so much, Jan. My name is Patrick. As you have heard, my name is Patrick To. I'm a nurse working in Kenya. I'm also a COIN board member. COIN stands for Council of International Neonatal Nurses. I represent nurses globally. I promote sharing of knowledge and quality care. I champion healthy working environments and embrace teamwork and collaboration while providing care. I'm also a member of International Council of Nurses. So nurses play a very key role in providing care among healthcare, especially to the adolescents. So over a long period of time, adolescents have been neglected, and actually an estimated 1.2 million adolescents die each and every year, largely due to attributable to preventable causes. And this can be reverted if the healthcare system is streamlined. So this includes providing adolescent-friendly services, subsidizing the cost of services, and increasing also the workforce. So as young nurses, we play the key role in the healthcare system, and we promote the care of adolescents through various ways. So we offer preventive care services, we offer health education services, and these healthcare education services are geared towards providing key health messages to adolescents, such as sexual reproductive health services, mental health issues, drugs and substance abuse, counseling and psychological abuse, sexual health and reproductive services, advocacy for the adolescent rights, and also as nurses, we also take lead as leaders and management in our facilities. So why is this very important to us? It is very important to us because we need health-specific training to be given to the nurses to be able to meet the universal healthcare services provided to these adolescents. So very few nurses have been trained in adolescent health, and this one affects the output pertaining to the care given to the adolescents. So there is need to incorporate more trainings to meet the needs of demands of the adolescents. And just to mention a few, we need to create awareness of the available online courses that we can be used, communication and counseling skills that also can be utilized by nurses. These platforms will equip and enable the nurses handle adolescent health-specific related issues as we prioritize the rolling out of universal healthcare services. So young professionals have a very special role between adolescents and the young people and the healthcare professionals. So we form a link between the other healthcare professionals. We actually become the first front workers to be met by these adolescents. So we offer those friendly services. We also most adolescents prefer to talk to their family friends, to their family members and friends as the frontline people before they come to the health facilities. So when they come to the health facilities, the first people they meet are us as nurses. So we need to continue encouraging that linkage so that our adolescents get the services. So as I wind up, the government should support adolescents' activities. They should train nurses, especially in adolescent-specific activities that are geared towards preventing these diseases and that are attributable to the deaths that our adolescents are having. And also, we need to strengthen the universal health care. Thank you so much.
Passing over to Melis.
Thank you so much, Jahan. I'm honored to address you of the International Association for Adolescent Health, representing not only our organization, but also the collective commitment of the PMNCH, Healthcare Professional Associations constituency. Together, we are dedicated to advocating for the fundamental principle of including all adolescents and leaving no one behind. But to achieve this goal, there is an urgent need for a healthcare workforce that is well equipped and trained across disciplines and according to globally accepted guidelines, so that we can deliver effective, safe, and respectful care to adolescents and their families. However, there is a significant global shortage of accessible adolescent-friendly services, particularly in regions with high youth populations. Similarly, the delivery of high-quality, sustainable, culturally tailored, and competency-based adolescent health training is limited and often concentrated in high-income countries. The change will start by investing in the proper training and professional development of emerging professionals. They are now on the front lines of healthcare and soon to be global and national leaders in adolescent health. And investing in their training not only empowers our current healthcare workforce, but also it's a crucial investment in the future of adolescent health. For all our adolescents to thrive, be nurtured, heard, and protected, we need high quality, easily accessible, up-to-date, holistic, and free healthcare services everywhere. We need these services to address the unique healthcare needs of adolescents by integrating their perspectives and insights into the system. We need these services to be equipped with an adequately trained workforce who prioritize not only their physical health, but also their mental and social health and well-being. And we need mental health to be an integral component of this care system. We need stigmatization and barriers to mental health services to be dismantled so adolescents feel safe and encouraged to seek help when needed. The need for this change and progress is pressing and immediate. We strive for a world where every adolescent's well-being is at the forefront. Together, we can create a brighter, healthier future for adolescents everywhere. Thank you for your dedication and support to this vital cause.
Thank you, Patrick and Melis, for addressing the access of care for adolescents and why should it matter to young professionals. At the International Federation of Medical Student Associations, we hold a very strong emphasis on promoting adolescent health through self-care and digital interventions to complement the health services we already deliver in order to achieve UHC, including building their healthy habits and also taking care of their mental health. So now we're going from problems to solutions. And it is my almost pleasure to introduce Kelly and Ruth, who will share with us some examples of youth-led processes that are contributing toward integrating adolescent services into health systems. So Kelly is the lead ASRH advisor at Save the Children, and Ruth is our youth and gender specialist at Copper Rose, Zambia. Over to you, Kelly and Ruth.
Great. Thank you so much. It's such a pleasure to be here with you all today. To achieve what young people want, as Aditi so nicely presented, we can't just do what we've always done. We can't just focus on an adolescent room or an adolescent-friendly corner here and there. Instead, as we've heard from our other panelists, we must work to ensure that all aspects of the health system, from the health workforce to the health information systems, to the places where services are delivered, meet the needs and rights of adolescents. Only then will we achieve universal health coverage. I'm pleased to introduce and present to you my colleague, Ruth Lataba. Ruth is working together with us on the USAID Momentum Country and Global Leadership Project, and she's going to share how adolescents in Zambia are leading a process of assessment and accountability to advance adolescent responsive health systems for all adolescents. Ruth, over to you.
Thank you, Kali. So to start with, Zambia has prioritized adolescent health as part of achieving the SDGs. So this is included in the adolescent health strategic plan, as well as the national health plan, which puts forward the adolescent responsive health systems pathway to attain a universal health coverage. However, gaps remain in the ability of the health system to provide comprehensive health services to adolescents. So Koparo Zambia, a youth-led organization in Zambia, under the Momentum Country and Global Leadership Project, led a participatory process in Northern Province as well as Central Province to assess how the health system is currently meeting the needs of adolescents. So we used an adolescent health and gender responsive health system assessment tool, which was developed by WHO and looks at 6 health building blocks plus the community building block. So this process was facilitated by young people, and it was done in such a way that we called stakeholders to be a part of this assessment. Stakeholders such as the neighborhood health committees, the district health management officers, as well as the healthcare providers themselves and the members of the communities. We also had workshops with adolescents and the peer educators that are found at the youth-friendly spaces. So after the assessment was done, the districts, as well as the district management officers, as well as the adolescents, developed action plans to identify the identified gaps. So in terms of the selected gaps and proposed actions, some healthcare providers deny adolescents certain services on grounds of age and other characteristics. So the proposed action was to enhance capacity of health workers in the delivery of comprehensive quality services for adolescents, as well as strengthening adolescent considerations in the mentorship approaches. We also noted through the assessment that most vulnerable groups of adolescents, for example, those living with disabilities, are not able to access services. And so the proposed action was integrate adolescent health in existing health service outreach activities, as well as accommodation for diverse adolescents. We also noted that adolescents do not participate in the established social accountability mechanisms. Here in Zambia, we call them the INDABAs. So the proposed action was engage adolescents in social accountability processes, engage adolescents in the key decision-making spaces where they're able to speak and share what their needs are. So what then is our next step? As a country, but also as Momentum, we want to provide technical assistance and capacity strengthening to the districts in line with their prioritized actions as a way of strengthening a responsive as a way of strengthening the responsiveness of the health system and accelerating action on adolescents as part of the universal health coverage. We want to ensure that the health system is responding to the needs of adolescents. The adolescents themselves are involved in the planning process, are involved in the service delivery processes and all other processes that the ministry has, because we do not want the ministry to plan for adolescents without them. The adolescents know what their needs are. Thank you.
Thank you. Thank you for that, Ruth. And I note that there are some videos that have been posted by our colleagues at Save the Children from some of the working countries that provide some more detail about some of their activities beyond what we had time for in the session today. So we're now going to shift gears a little bit and go from hearing from young people about their needs and hearing from some of the examples of in-country solutions to hearing what some of the healthcare provider organizations have been thinking about and doing when it comes to addressing the needs of young people when it comes to healthcare services. And we've also asked some of our global stakeholders, the UN agencies, WHO and UNICEF, to share some comments about what they do to try to address these needs on an ongoing basis. The first comment there comes from Dr. Naveen Thakur, who is the president of the International Pediatric Association. And over to you, Naveen, for a discussion of healthcare professionals' commitments.
Thanks, John. Hello, everyone. I'm truly delighted to be here and talk about our joint healthcare professional commitment to adolescent well-being. First, let me start by giving assurance to you, adolescent and young people, that we are listening to you. We are committed to act on your ask. I have taken note on comments and questions made also during other sessions during the forum, and we will work on them. When I say we, here I am speaking for other healthcare professional associations as well, bringing together the voice and commitment of millions of healthcare professionals across the globe. As PMNCH Healthcare Professional Association constituency, we consider prioritization of adolescent health and well-being critically important for young people across the life course. It means that investing in adolescent health and well-being affects adolescent present health, their future adult health, and their children's health and well-being. Therefore, it is so critical also to achieve improved outcomes for maternal, newborn, and child health, as well as sexual and reproductive health and rights. The HCPA constituency and its member organizations such as COIN, FIGO, ICN, IAAH, and IPA, and representing doctors, nurses, midwives, are joining together to commit to the improving adolescent health and well-being by initiating and strengthening collaboration by our member National Healthcare Professional Association to prioritize and work together to improve adolescent health and well-being. Second, ensuring respectful care, including confidentiality and anonymity, respectful treatment. Advocating for capacity building and ongoing training opportunities across different disciplines to ensure a strong and effective task force of healthcare professionals across discipline able to provide adolescent appropriate services. Investing in early leadership, including mentorship program. And finally, advocating to ensure universal access to sexual reproductive healthcare services. My dear adolescent and young people, we are open to your advice on how we can best ensure healthcare is tailored to your needs. Let us work together to ensure every adolescent can thrive. Thank you.
Thank you so much, Naveen. Our next speaker is Joanna Lai from UNICEF. Joanna is the lead for adolescent and mental health for the technical side at UNICEF and Health at headquarters. Joanna, over to you.
Thank you so much, John. And it's so important that we get to hear what young people are saying today and that we're seeing such strong efforts that they're leading. As Dr. Naveen has reinforced, we are really listening to what young people around the world are saying, and we hear you. At UNICEF, health and well-being of adolescents is at the heart of our mandate to ensure the rights of all children, which includes adolescents. And so our commitment to adolescent health and well-being is integrated across all 5 goal areas of our strategic plan. That's focused on advancing policy, action, also programming that's across systems and across sectors that, yes, address the risks, but also boost the protective factors that are impacting health and well-being outcomes of adolescents. And what this means is we are focused on and committed to partnering first and foremost with adolescents themselves, also their caregivers and their communities, to proactively empower them and work with them to care for their own health and their own well-being. That also means that we're working to invest and strengthen systems and workforces across primary healthcare, education, social protection systems that will help us better meet the health and well-being needs of adolescents in a gender-responsive way. And also that is focusing our advocacy and our policy efforts on also the social, commercial, environmental factors that are placing health and well-being of adolescents at risk. So these are some of the commitments that we look forward to continue working with partners and also young people around the world to continue advancing on.
Great. Thank you so much, Joanna. Next, we have Valentina Baltag, who is at the World Health Organization in maternal, child, adolescent health and nutrition, discussing their focus on young people.
The universal health coverage goals cannot be achieved without investing in adolescents. This is why the World Health Organization works tirelessly to ensure that adolescents are visible in the UHC agenda. The latest example is the political declaration of the UN High-Level Meeting on Universal Health Coverage 2023 that calls, among others, to include a focus on youth to ensure that no one is left behind. There are no better solutions to ensure universal health coverage for adolescents than by investing in adolescent responsive health systems. To this end, the Global Accelerated Action for the Health of Adolescents Global Guidance, the AHA guidance, is a key resource. Everyone has a role to play in translating the AHA recommendations into concrete actions in countries, be it through advocacy and activism or capacity building or service provision. We, the AHA UN partnership, stand ready to support you in your efforts and to ensure that adolescent health and well-being are visible in health and well-being agendas of governments and at the global level.
In addition to the maternal, child health and adolescent piece of WHO, there's the global coordinating mechanism for non-communicable diseases. And the prevention of non-communicable diseases, as well as access to care, is a critical component of how we think about what adolescents need when it comes to staying healthy and being able to thrive. So we have Yvonne Aravaligan from the Global Coordinating Mechanism standing in for Guy Phones, the director of the GCM, because of his travel disarrangement and lack of internet access. Thank you so much for being here, Yvonne, and over to you.
Thank you very much, John, for the introduction. So I'm Yvonne. I'm with the WHO's Global Coordination Mechanism on Non-Communicable Disease. And this is a statement that we've prepared with our very close partner, NCD Child. So our view is that global commitments around adolescent health and non-communicable disease require strong youth participation and empowerment. And this approach views adolescents as co-creators, designers, and implementers, rather than simply recipients or stakeholders. An important consideration here is the meaningful engagement of young people who live with non-communicable disease, mental health conditions, and neurological conditions to shape the relevant agendas. So at the GCM, we've been committed to adolescent health and well-being since the inception of the platform in 2015, over a range of activities, including a community of practice for young people, NCD Voices in the Decade of Action, where we raise young voices, and the NCD Lab thematic area on the next generation. And the NCD Lab is a WHO platform that supports promising grassroots innovations to achieve scale through knowledge collaboration, capacity building, and strategic partnerships. And our thematic area on NCDs and the next generation is co-chaired by the NCD Child, and it promotes and advances the participation of young people in the prevention and control of NCDs, introducing novel innovations and youth-driven strategies to address the commercial drivers of poor health. And we're very happy to have one of these innovations represented at the Global Forum for Adolescents just yesterday at a session. Again, kind of reiterating WHO's commitment to featuring some of these works and shaping global policy and practices from a youth-driven perspective. Thank you.
Thank you so much, Yvonne, for sharing that. And then our last speaker in this section is Natalie Ainsworth. And she's speaking on behalf of the Young Health Programs at AstraZeneca. She's their Global Community Investment Manager. And this is a commitment that the Young Health Program has made to supporting positive youth development in a variety of ways globally. Natalie.
I'm Natalie Ainsworth, Global Community Investment Manager at AstraZeneca. Thank you to PMNCH for inviting me to participate in today's session, and welcome everyone to the Global Forum for Adolescents. AstraZeneca's Young Health Programme is our flagship community investment programme with a unique focus on young people aged 10 to 24 living in vulnerable environments and under-resourced settings around the world. The YHP aims to prevent the most common non-communicable diseases such as cancer, diabetes, heart disease and respiratory disease. A holistic and integrated programme, it combines community programmes, research and advocacy and supports the development of young leaders. It's part of our sustainability commitment to accelerate delivery of sustainable healthcare and use our capabilities to strengthen health systems and improve equitable access. One of the core objectives of the Young Health Programme is to improve health systems, including access to and quality of youth-friendly services so they meet the specific health needs of young people. Through scorecarding, a youth-led tool, young people assess the quality of the health services available to them. By doing this, young people are able to identify their own specific needs and come up with recommendations that enhance equitable access to quality youth-friendly health services. Scorecarding has helped to identify tangible improvements and opportunities to design and implement adolescent-friendly health interventions. Examples of this include recommendations for more and better youth-appropriate health education materials, more youth-friendly facility opening times, or more youth-friendly non-communicable disease screening programs. The findings of scorecarding are also used to target local government stakeholders and decision makers to ensure that young people in all their diversities and of all backgrounds have access to affordable, quality, non-discriminatory care. Through these activities, the Young Health Programme aims to reduce healthcare inequality by improving access to and quality of health services for young people. Thank you.
And we appreciate that commitment and the support that the Young Health Program brings to helping organize some of this work in countries. So we have now time for our second interactive poll, and the question should be coming up on your screens. On a scale from 1 to 5, are the current health systems in your country adolescent responsive and adolescent inclusive, with 1 being that they're completely unresponsive, and 5 being that they're very responsive and inclusive when it comes to the health services that you can get access to in your country. So that poll is now open, and we'll be closing it after about a minute, so that we can have a little bit of discussion about the results. And if I can bring Jahan and I both into the screen now, we'll have a little bit of discussion about some of the questions that have been posted in the chat. But first, let's bring Jahan in as well for some comments.
Thank you, John. Yeah, so while everyone is voting on our second poll, I also want to take a minute to share some very key insights that we found on the issue of adolescent health. So earlier on, a key paper we drafted that surveyed over 355 medical students worldwide found that the problem don't just exist in the lack of access and coverage, but begins systematically as early as medical school. So 56% of our respondents felt that there was inadequate coverage of adolescent health in their curricula, compared to 6% feeling the same about adult health topics. So in the first poll, we saw that mental health and sexual and reproductive health and rights were the largest issues perceived to be affecting adolescent health. And in our survey, our students similarly expressed difficulties in these areas. Respondents expressed large difficulties in identifying signs and symptoms of trauma, bullying, behavioral addiction, self-harm in adolescents. And furthermore, 90% of medical students expressed difficulties on supporting adolescents on the topic of coming out. Over 70% had trouble with topics like gender expression and creating safe spaces. And over 60% had trouble with topics like safer sexual activity and sexting and online sexual activities. In fact, even our final year medical students only expressed an overall 3.3 out of 5 in their confidence in addressing adolescent health issues. So I think that's a very significant thing to bring our attention to, that the inadequacy of inclusion of adolescent health is also rooted in this disregard shown by many medical schools in including adolescent health in their curriculum. And I think now we should have the results for the poll. So the greatest number of people chose 2 on the scale of 1 to 5 of how youth responsive and youth inclusive do they think their country's healthcare systems are. And what do you think, John?
Well, I think I would like to know which countries are scoring in the 4 and 5 range, because it looks like we have a long way to go to bring the quality of care and the responsiveness of care up to where we'd like it to be for young people. One of the questions in the chat that came up is, how do we access adolescents and youth that are at greatest risk and don't access health systems? And there were some related questions about outreach and communication. And I'm going to ask our tech people to bring both Melis and Katja onto the screen with Jahan and I. And you know, I think to kick off a little discussion about that issue of access, I think we've got, you know, most people in the world, including most young people, will only see one frontline healthcare worker in their life. And so we have an issue in reaching every community and every young person and making sure that the healthcare worker at that front line has the skills and knowledge to be able to address prevention and treatment as it's needed and get access to different levels of care. But Melis and Katja, we'd love to hear your thoughts as young professionals about this issue of communication and reaching everyone with services. Let's go to Melis first, up to a minute.
Thank you so much, John. This is a great question, and I don't think it has only one answer. It's a very, very complicated way to achieve this, but we should prioritize the youth that are most vulnerable and very hard to reach to. And for that, I think the first step should be all the governmental policies and funding and resources to prioritize the vulnerable youth that don't have any access to healthcare or resources within the healthcare. So this should be the first step. And what I have in my mind is that we also have schools, and schools are a very, very strong places to invest in, because health promoting schools can help with the empowerment of the youth, with health education in topics like mental health, sexual and reproductive health, as discussed by many of the panelists of this session. And finally, again, as discussed, digital healthcare seems to be one of the future goals for youth that have access to internet, if not to healthcare access. But unfortunately, the youth that don't have any access to healthcare systems mostly don't have any access to digital healthcare as well. But for the ones who are in school and for the ones who have access to digital healthcare, I think integrating the digital healthcare systems within our healthcare systems is one of the other steps to achieve this goal.
Great, thank you, Melis. Let's go over to Katja for less than 1 minute, if you can, because Patrick and Ruth also want to make quick comments on communication, if we have time.
Yes, of course. Well, I think that sometimes we overthink in terms of how to access adolescents and youth, because we can access them through other adolescents and youth, because youth is especially well connected. And we are also very good at peer-to-peer education and community-based learning, shared learning, and so on. And these can be great tools that you can use, especially if you then also have from the other side, the support of governmental policies and the stakeholders, the decision makers that are actually providing you with the necessary platforms to actually support this integration of youth at risk and integrating them better into healthcare systems. And the last thing I want to also mention is that youth play a big role in sharing different aspects of health literacy. And this is something that is a big part that our education also needs to focus on, because with good education and better health literacy skills, we're also able to bring this disadvantaged youth to the table, have them, have their voices gain strength and really be integrated into the healthcare systems according to their needs.
Patrick, I can give you 30 seconds. We're rapidly running out of our time.
Thank you so much. Another way we can ensure there is communication, there is access to the healthcare, is through use of community health volunteers. So the community health volunteers can be used to actually help these vulnerable populations within the community, as they are found within the grassroots. So they can be the ones who forms a link between these adolescents who doesn't know where to go if they have problems. So they can just use these community health volunteers to show them navigate the healthcare systems and also the social systems. So this one will also help in reducing isolations and ensure that there's optimal use of and seeking of healthcare. Thank you.
So I'm sorry, Ruth, we're going to run out of time because we have a sharp ending on the platform. Jahan, you have about a half a minute for our closing comments, and then we'll end. And I think I want to thank everybody now, all the speakers. I don't know if you know that there are more than 5,000 people logged in to the session over the last 2 days, and it's really a very exciting opportunity to share these messages. And it's a place where we really want accountability for the commitments that are being made. So I'm so glad we had folks here from the different agencies, that we're all listening carefully to what young people want and moving forward to address young people's needs. Jahan, over to you for the closing comments.
Thank you, John, and biggest thank you to all our speakers. So as John has already said, so at the moment, the biggest thing is execution. So at FMSA, we strongly warn against the pitfall of tokenism, and rather all stakeholders should ensure the voices brought on are actually heard, acknowledged, and incorporated. We strongly advocate for accountability and also feedback system. And yeah, again, thank you everyone for joining today. And